The threat of some wet weather in Florida has many communities in the Sunshine State worrying that heavy rains could boost the population of Zika mosquitoes. Florida already has over 500 cases of the virus, and as children and young adults head back to school this week, parents want to make sure that their kids are safe. Dr. Julio Frenk is president of the University of Miami and an expert in public health. He joins me now. As we mentioned, you are a doctor, and I was really impressed to see the number of things that your university had put in place to battle back. Let me ask you about some of them. One of them, your custodial and landscaping service began installing bricks of insecticide in the storm drains around campus. You've given students repellent spray and wipes around campus. You also began preparing for Zika a year ago, developing a diagnostic blood test that's less expensive than the current option and gives quick results. That sounds like something that needs to be shared.
Yeah, absolutely. It's, we've been getting ready for this situation because on the one hand, we had an obligation to our own students, our own staff, and our own faculty. But on the other, we are a university, and universities, through their research, are the engine that generates the solutions to common problems. And our teams have been very focused more than a year ago in developing diagnostics and working on an effective vaccine, new ways of controlling mosquitoes. This is not going to be the last epidemic we will see, and we need to develop the tools, invest in the research and the public health infrastructure to make sure we're prepared for this and future epidemics as well.
I mean, it's impressive that you guys are taking it so seriously and being so proactive to do something on your own rather than waiting for the government to step in and do that for you. I really commend you on that. In terms of the test, because a lot of people have said that if you go to your doctor and you try and get some sort of diagnostic test, they don't necessarily have it, they won't necessarily give it to you, it's not that accurate, you don't get the test quickly. How were you able to do this?
Well, we have a group that's been working on diagnostic of viral diseases, which started with AIDS many years ago. And this is what happens in research universities like the University of Miami. You build this capacity to deal with, to face changing threats. So based on those platforms, those scientific platforms, Dr. Myra Stevenson and others in our faculty have been working on a fast, much cheaper diagnostic test. We're actually moving forward seeking FDA approval so that you can have that diagnosis, which is so critical for early intervention.
Yeah.
And as I say, the other side of this is better prevention through a vaccine and better control of the mosquitoes. We've also done mapping of where the mosquitoes breed, what are their habits, can we better control those populations.
No, definitely a vaccine. What about a cure? What's work like that? How is that going once you have it?
Well, we currently don't have a cure, but there are many things that can be done to orient patients and certainly also to screen patients. In the case of Zika, of course, we have the challenge of also screening babies.
Right.
In the case of pregnant women that might be affected, and our UHealth, our academic health system, our hospitals have worked on some of those screening tests, particularly when it comes to eye defects that might be present. So, we are very active both in protecting our own students, but also in generating the research and healthcare for our community.
Advancing the science. Thank you so much. Dr. Julio Frenk of the University of Miami, we appreciate your time today. Thank you.